QALY stands for Quality Adjusted Life Year, a key metric in health economics used globally. It quantifies the value of medical interventions by considering both the quantity and quality of life gained from treatment. In many nations, QALYs are used to assess the cost-effectiveness of medical treatments. They inform decisions about insurance coverage, treatment choices, and health program evaluations. To calculate QALYs, we multiply the number of years spent in a particular health state by a quality of life utility value, which ranges from 0 to 1, with 0 being equivalent to death and 1 meaning perfect health. For example, living 2 years with a utility value of 0.6 equals 1.2 QALYs. Charts like this illustrate how treatment can improve life expectancy, quality of life, or both, helping us to estimate the overall quality gained from various interventions. Determining utility values is central to QALY calculation. 3 common methods are time trade-off, where people indicate how many years of life they give up to avoid a health condition, standard gamble, where the utility calculation is determined by observing the willingness to accept a particular risk of death to avoid a particular health state, and visual analog scale, where people rate health states on a numerical scale. These methods rely on surveys and individual preferences, since health is a subjective and multifaceted concept that is hard to quantify objectively. QALYs are widely used in more than 80 countries, including the UK, Canada, and Australia, to inform healthcare funding and coverage decisions. In contrast, their use is effectively banned in the United States. In 2024, the Protecting Healthcare for All Patients Act, H.R. 485, prohibited QALYs in federal decision-making, citing concerns that they might unfairly devalue the lives of people with disabilities or chronic conditions. This controversy highlights ongoing ethical debates around how we measure the value of health and whose perspectives are reflected in those measures. The 2024 US ban on QALYs has intensified the search for alternative value measures that address ethical concerns while supporting evidence-based decisions. One emerging alternative is equal value of life years gained, which focuses solely on life extension, assigning equal value to each additional year of life regardless of health quality. Another metric is health years in total, an additive model combining years lived and quality of life, offering a different perspective from QALY's multiplicative approach. While no single measure has yet replaced the QALY, these alternatives reflect growing interest in more inclusive and equitable health metrics. The debate is ongoing, and the future of value-based healthcare in the US remains an open question.